Hello and welcome to this section, Basic Life Support. So this is Standard 12 of the Care Certificate. So let's have a look and see what it says. So in Standard 12, you must have the skills and the knowledge to be able to save somebody's life. This means you have to have knowledge around basic life support. And there's three processes around basic life support. We have the initial assessment, we have checking the airways, and then we have the ability to perform CPR. As we go down initial assessment, we carry out what's formally known as the primary survey. And here we use the acronym DRABCD. So Doctor ABCD. Danger, response, airways, breathing, circulation and defibrillation. So that's the easy way to remember it. You will need further training beyond this because this is the minimum requirement, and again you'll do a one-day training course further down the line in your career. However, for now this is the minimum requirement. So let's just run through the acronym Dr. ABC. So danger, am I or the casualty in any danger? So we need to look around. There must be a reason why this person is on the floor or unconscious. Response, so we're looking at levels of unconsciousness called the Glasgow-Coma scale. And on the left-hand side, you'll see the acronym AVPU for alert, voice, pain, and unresponsive. So am I, or is the casualty alert? Are they able to talk to me? Voice, can they respond to my voice? So if I give them a command, can they follow that? Maybe they're asleep, or maybe there's an inability to hear me, so will they respond to pain? So we can pinch their ear or rub our finger across their eyelids to provoke some kind of movement. And finally, if there's nothing there, we'll assume they're unresponsive, and therefore we're going to carry on with our primary survey. We're then going to go to A, so we'll tilt the head back. So two fingers, and again, we put our fingers like guns, and the reason we do that is to avoid choking the casualty. So two on the forehead, two on the mouth, we tilt the head back, and we look in the mouth. So the only thing that should be in the mouth are teeth, tongue, and gums. Anything else, we can tilt the head to one side, scoop out with our little finger. If we can't pick it out from the top, we don't go digging. Breathing, we're going to look, listen, and feel for 10 seconds. So we're looking for the rise and fall in the chest, we're listening for breath on our ear, and we're feeling for breath on our cheek because our cheek's sensitive. C, so we're going to now need to call for help. We're going to need assistance. So at this point, you can shout out help, maybe somebody will hear, and at that point, you may ask for a defibrillator. So if somebody then comes along, ask them to call for an ambulance and try and get a defibrillator. Moving it in to early defibrillation. So as soon as they arrive, you can start the principles of early defibrillation. So let's show you that in action on an adult. So let's put that into practice. Danger, am I or the casualty in danger? Let's sweep the body, make sure they're not plugged into anything, or maybe they've been injured in some way. Response, hello, can you hear me? Can you open your eyes? So again, we're doing both ears, just in case they're hard of hearing and they can't hear you. At this point, there was no response to the voice, so I'm going to pinch their ear for a bit of pain. Or alternatively, I can rub my finger over the eyelid and hopefully they'll flinch. If they flinch, they're still responsive. If there's no movement, they're unresponsive. So at this point, I know I have an unconscious casualty. So if I could call for help, I may just shout help and hopefully somebody might hear me and eventually arrive. But I'm going to now move into my primary bit, airways, breathing, and then circulation. So airways, two fingers on the chin, two on the forehead, and I'm going to tilt the head back. I'm going to extend the mouth and I'm going to look in. So I'm looking for teeth, tongue and gums. Anything else, I'm going to sweep the mouth and take it out. I'm going to go down for breathing. So I'm looking down the chest for the rise and the fall. I'm listening to the breathing and I'm feeling on my cheek. And I'm going to do that for 10 seconds. So at this point, I'm going to call for an ambulance or call for help. So, help! Could you please pass me a defibrillator? Wonderful. And then hopefully you'll get a defibrillator to hand in the ideal world. So, at this point, Imagine we haven't got that yet, but we've got it. We're going to start doing our chest compressions. So we need to find the bottom of the sternum, and we place 2 fingers and then our marker. Now, that's the best place. The reality is, don't waste time, just go for the centre of the chest. So again, we can go centre of the chest. We're going to lock our hands, we're going to lock our arms, and if you hear that click, that's the depth in which I need to go. Now I need to do 30 chest compressions and 2 rescue breaths. So at this point, we need to be aiming for about 100 to 120 chest compressions a minute, and ideally being doing 3 cycles in a minute. So it looks a bit like this: 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 10 and 12 and 13 and 14 and 15 and 16 and 17 and 18 and 19 and 20 and 21 and 22 and 23 and 24 and 25 and 26, 27, 28, 30. We're going to move up to the head, we're going to pinch the nose, and we're going to open the airway. Now you may have a face shield or PPE in which you can use, and during this current climate I would definitely use face shields. I'm going to open the mouth, and I'm going to open my mouth as much as I can, and I'm going to get a seal. I'm going to blow once, and you'll see the chest rise. I'm going to let it fall, and I turn my head to the side. I'm going to go again, and I'm going to move my head to the side. Now we move our head to the side for 2 reasons. One, if I'm doing this all the time, I'm not getting myself fresh oxygen and I'm breathing in stale air. And 2, if I blow too hard, the air could go into the stomach and I could receive the stomach content in my face. So I want that to hit my side, not my mouth. So we're going to carry on 30 chest compressions, 2 breaths. Once the defibrillators arrived, we can start early defibrillation. So, to use a defibrillator, they are all slightly differently. We'll take them out the packets, and you'll have an on button and a shock button. The on button will always be green, and the shock button is normally orange. If you turn it on,
training scenario,
it will tell you what
1.
to do.
Adult patient. Call for medical assistance. Remove clothing from patient's chest to expose bare skin. Pull green tab to remove pads. Peel pads from liner. Apply pads to patient's bare chest, as shown in picture. Press pads firmly to patient's bare skin. Pull green tab to remove pads.
So it will keep
Peel
telling
pads
you
from liner.
what to do as you go
Assessing
through.
heart rhythm. Do not touch the patient.
Okay, so at this point, it's flashing and it's asking
Analyzing.
you to
Do
stand
not
clear.
touch the patient.
So stand clear, everybody. Stand clear.
Stand clear of patient. Shock advised.
So if it
Stand
advises
clear
the shock,
of patient.
you'll see it power up,
Press the orange shock button now.
and we press.
Shock delivered. Begin CPR.
1 and 2
It is
and 3
safe
and
to
4
touch
and
the
5 and
patient.
6 and 7 and 8 and 9
Place
and 10
overlapping hands
and
in
13
middle
and
of
14 and
chest.
15 and 16 and 17 and 18 and 19 and 20
Press
and 21,
directly down on the chest in time with
26,
metronome.
27, 28, 29, 30.
Remain calm. Good compressions. Good compressions.
24, 25, 26, 27, 28, 29, 30.
Good compressions. Assessing heart rhythm. Do not touch the patient.
Hands off.
Analyzing. Do not touch the patient. Stand clear of patient. Shock advised.
Again, if the
Stand
shock's
clear of
advised,
patient. Press the orange shock button now. Shock delivered.
okay.
Begin CPR.
So you can see the metronome.
It is safe to touch the
That's
patient.
the heart rhythm in which you need
Place
to be beating.
overlapping hands in
So
middle
it's
of
1
chest.
and 2 and 3 and 4 and 5. So you can see
Press
the speed
directly
in which
down
you
on
need
the
to work.
chest in time with...
Okay, so that's our CPR for an adult. Now obviously a child is slightly different, and for a child we're going to perform CPR at a similar rate, however we're going to adjust what we're doing there. So I'm going to show you now the same process but with a child. So with children we need to decide what a child is, because the reality is, even though we have age ranges on children, some children are much bigger or smaller than others. So the rule of thumb is, if I can pick the child up with 2 hands, that's a child. If I couldn't pick them up, then actually we're going to do 2 hands. So this one differs for children, so we're still going to follow the same thing. Danger, am I or child in danger? Response, hello, can you hear me, can you open your eyes? We're still going to do airway, we're still going to do breathing. I'm still going to call for help, and I'm still going to want to get an AED. The only difference in the sequence now is I'm going to use 1 hand for the chest compression and not 2. So here you can see that I don't have to use as much force to get that chest compression in. With a child, the breath that I'm putting in then isn't as much as an adult as well. So it's a rather than a. Okay, so it's enough to blow a candle out, enough to blow a balloon up just slightly. So the breath we put in is just a mild amount of breath. Okay, so that's a child. Now we'll move on to the baby. Okay, so babies again are slightly different. Again, different sized babies. They recommend a child under the 1 year of age is considered a baby. However, with babies, we don't need them on surfaces because we can perform everything in our arms. And what it means is we can have the baby in our arm whilst we're performing our checks and doing CPR, and we don't need to leave a baby unattended. Now again, same sequence, we're going to follow everything that we've done here. The difference is now we're going to use 2 fingers, and the breath is enough to blow out a birthday candle. So our chest compressions here, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. When we put the breath in, we need to now cover the mouth and the nose, and it's enough to blow a candle. Okay, and then back. So that's your CPR for a child. Moving on. So looking at obstructed airways, which is another common cause for loss of life, it's very typical in care services for people to be able to choke and asphyxiate. So it's important that we know how to maintain good airways, and it's a crucial part of our CPR process. So airways was our first priority with breathing. We know if we've got somebody with an obstructed airway that actually it's a critical condition to be in, and loss of life could occur quite quickly. Therefore, it's important for you to recognise signs and symptoms of choking immediately. Things in which you might see is people grasping their throat. You may see that they've got difficulties in speaking. You may see them crying, and maybe there's mucus coming out of their nose. Their face might be going red. Their eyes will start to dilate and worrying, and they're going to be displaying that they're quite distressed. It's important then to follow the basic treatments for this. So I'm going to ask my colleague to come in, and I'm going to demonstrate how to help somebody who's choking. So it's really important to observe signs and symptoms. We can see that our patient is choking. So the first thing we should ask them is, are you choking? And they may nod to tell you. Okay. So what we're going to do, we're going to ask them to cough 5 times. So if you can cough for me. Okay. Again, if you're worried that that's not working, be prepared to carry out 5 back slaps. Now for this you need to prepare your legs in a stance position so you're nice and firm, and we're going to place a hand around your arm around their hand, around their kind of chest area. And on their back, so if we turn around, we're going to hit them in the back sharp 5 times. So 1, 2, 3, 4, 5. And again, ask them to cough throughout. If that hasn't worked, we're now going to move into the abdominal thrust. So it's important we're still trying to clear the airway. For this, you're going to stand behind your casualty and you're going to make a fist. You're going to bring your thumb up and you're going to drive it into the bottom of the sternum, so the bottom of the stomach. Here, you're going to push in and up sharp, and you're going to do that 5 times. So, ready, and hopefully something will come out, and if it doesn't, we're going to do that 5 times. If that then doesn't work, we're going to go back to holding and back to patting. And we're going to repeat that cycle over and over again. Thank you very much. If then the person doesn't clear their airways, what's likely to happen is they will eventually go unconscious and fall on the floor, and therefore we'll go back to our CPR principles. So we're going to start to be prepared to carry out our chest compressions. Now, let's show you that on what we would do with a child or a baby. And for children, we're going to lean the child forward. So again, we can place them over our knees and we're going to pat them on the back. We just don't go as hard as we did with the adults. Now, for the abdominal thrust, again, we're going to make our thumb, we're going to go under the stomach and we're going to push in and up. We just don't use as much force as what we would with the adult. So again, the same sequence. We're going to try and ensure that we're going to calm them down. We're going to ask them to cough. We pat and we do the thrust. And then finally, let's look at what we can do with the baby. Okay, so with the baby, the important thing is we don't need the baby to leave our arms. So what we're going to do, we're going to support the baby in our arm, and we're going to support the neck and the head, and we're going to tap with 2 fingers on their back. So we're going to push that way. For the abdominal thrust again, we're just going to use 2 fingers and we're going to push in and up. So same principles, just less force, and again we hold the baby in our arms. So hopefully you following those processes of asking the child or the adult to cough, doing the back slaps, or performing the abdominal thrust, you'll clear the obstruction. There is a chance that you may not clear it, and again, you're going to have to be ready to perform CPR. Now, let's talk about some of the practicalities of once you've performed that abdominal thrust. What you're doing, you're squeezing the diaphragm and all the organs together to push up the indirect force of air into the body to release the object from the throat. There is a risk that whilst performing any abdominal thrust, be it on the adult, child or baby, that you can rupture the organs in the person, causing further complications. Therefore, without any doubt, you must get medical assistance immediately if you perform any abdominal thrusts. So, we've covered the children, we've covered the back blows, and we've covered looking after the babies. We've covered the abdominal thrusts, and we've looked at CPR requirements for children. So let's move now back onto confidentiality. It's obviously important that if you perform CPR or any first aid on anybody, that we maintain confidentiality because people have a right for their data to be protected. It's important we follow the GDPR processes, and again, if we're handing information on to the emergency services, we use a process called SABAS. We talk about the situation, we talk about the background, we talk about what we did, and then we talk about any help or recommendations that we need. Record keeping is really important because the moment we've performed any level of CPR or first aid, we need accurate records to explain to people what we did and how we did it. As part of your training, you will be required to undertake an annual refresher update around basic life support. So it's important that every year you maintain your skills in performing CPR. So let's talk about the knowledge requirements. Okay, so now let's look at the knowledge requirements of what you need to know. So this is the theory part. So here, it's asking you to complete the following sentences. You simply have to fill in the gaps. So you should be protected with, and then here, you just fill in the gaps to answer it. That one's nice and straightforward. The next question is about from here. Can you find two of them? You just need to tick the ones that are the right answer. Okay, so that one's nice and straightforward. Here, you're going to match up so for example, danger, look at the right one, and you can write the letters that match the symbols, or alternatively, if you want to draw lines, feel free to draw lines. Here, we're looking for you to complete the blanks, so seconds to take to check normal breathing, and hopefully you'll give the right answer. This one, we're looking for you to label them in the sequence for managing a choking hazard, so encouraging to cough, back blows, etc. You'll put those in order between 1 and 4. And that's the end of the basic life support. So this module is relatively straightforward. You will be required to demonstrate CPR, the use of an AED, and to deal with a choking person before you go out and practice care. However, this isn't enough to make you a first aider. This is the minimum requirement for the care certificate. It's important that you upskill yourselves and take responsibility. Remember, first aid principles aren't just for working in care. These will help you in your everyday lives. You'll have children and family members that one day you might need to carry out more extended first aid techniques on. I recommend that you undertake at least a minimum of the 1-day emergency first aid course, which is an awareness, and it's about 6 hours. And in there you'll learn about basic life support, recovery position, CPR, you'll deal with bleeds and fractures and choking. Or alternatively, if you have a passion for it, do the 3-day extended course, which will then make you a first aider at work. Normally first aider at works receive supernumerary status, they receive extra payments and things from their employers, so again it's worthwhile you discussing that with your employer. But it does take 3 days to complete that training. Remember, first aid can be quite a distressing thing to go through. It's unlikely that you will successfully bring somebody around from a CPR situation unless you have early defibrillation. We go from 2% chance without a defib to about 49 to 50% chance with a defib. So it's really important that you have early AED. Also, it's important you receive supervision if you give first aid and you've been unsuccessful or even successful, because you'll need to manage those feelings and thoughts. So thank you for watching. Your assessor will give you feedback and you'll see me in Standard 13.